Hi, my name is Pamela Coons, Associate Professor of Medicine in the Division of Oncology at Yale School of Medicine and Yale Cancer Center. I'm excited to announce ASCO's new open access journal, JCO Oncology Advances. As the inaugural editor-in-chief, I hope to support JCO Oncology Advances to become the premier platform to bridge the gap between accessible scientific research and clinical care. Stay tuned for more information, including new article types, at ascopubs.org/JCO Oncology Advances. We look forward to seeing your submissions in spring of 2024.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement. Art of Oncology podcast presents Peri Gilpin reading the essay White Knuckling by Daniel Rayson.
Carrie hated her knuckles. Her skin tone was a product of an Acadian mother and a Portuguese father, and in the driving rain off the cool Atlantic coast, it took on a purplish hue, most noticeable around points of tension. Knees, elbows, lips, and knuckles were most affected. Gripping the plastic shopping bag filled with yogurt tubes, sandwich bread, and chocolate milk, the staples of her children's diet, her knuckles screamed at her. The tension created pale models within the violet, and she could see each tendon as it spanned the back of her hand. It was roughly an hour since she had disconnected Vera Duggar from the intravenous pamidronate that was meant to protect her breast cancer-riddled bones from further damage. Both nurses got on well with each other, despite the generations separating them. Vera was a neonatal intensive care nurse emeritus, now 78 years old. She had spent more than half her life caring for premature babies who should never have lived to see their own kids playing after school. In her line of work, when miracles didn't happen, it was clear for all to see, and the end was quick and complete. She knew no miracles awaited her and was intermittently frustrated at the time it was taking for this to be declared to everyone around her. Why was it taking so long? "I'm getting tired of this, my dear," she sighed in her persistent Yorkshire accent, now 55 years since leaving the United Kingdom. "Tired of what, exactly?" Carrie asked. "Oh, these trips to the hospital every 4 weeks, the pills and potions meant to keep me upright and comfortable, the fuss surrounding my every ache. I am 78, you know. Aren't I allowed to have pain without needing a scan to check on the cancer or change in medication? Who at 78 doesn't have some pain from time to time? Don't all us old people hurt?" Carrie smiled deeply and held on to her arm a little longer than usual while checking the intravenous site. She knew the incredible support that Vera had from those around her. A battalion of equally strong-minded, hard-working women who took turns driving her back and forth from the cancer center. She was aware that her every move was being watched and took extra care to make sure that the intravenous tubing ran a straight line from the clear bag of liquid to the back of her hand. She had cross-checked Vera's name with the planned medication 3 times and had a trusted colleague confirm that the right drug was going into the right Vera. "All you have to do is not complain about it, and no one would be the wiser," Carrie offered. "How can I do that when every grimace or grunt is hovered over? Sometimes I say I hurt just to let my doctors think they are doing something." It had been almost 4 years since the first real pain she had ever experienced declared the return of the breast cancer that a mastectomy was supposed to have rid her of 12 years before. At the time, she was told the cancer was small and the lymph nodes were clear and that tamoxifen for 5 years would prevent it from returning. She had difficulty believing how a pill could help, given her conviction that cancer, once invited to visit, never left. The return of the disease vindicated her suspicions. She had continued to agree to her physician's suggestions, not because she thought he was right, but in the hope that cancer medicine had progressed at a pace similar to the advances that she had witnessed over her time in the neonatal intensive care unit. When I started my training, patients didn't have bone protector medicines and different treatments to try and keep things stable, Carrie replied. I know, dear, but the end is the same, isn't it? The pace might have changed. The timelines are longer. But the end is what counts, and I know it is coming closer. I'm not afraid, you know. Carrie felt her eyes fill in response to this unequivocal statement. The images of a number of other patients filed quickly through her mind. All had been like Vera once. Disease stabilized, symptoms controlled, and adverse effects managed. But they were all gone. Some left after a prolonged series of increasingly chaotic and painful complications, and others just didn't show up for their next scheduled treatment. Over the past few years, images would appear to her abruptly, without obvious triggers. Walking into movie theaters or down grocery aisles, there would be times when she would have to slow her pace so as not to walk through the shadows of previous patients. The sight of a father with his blue-eyed, giggling daughter bouncing on his shoulders, fingers gripping his hair, sends a memory shiver of a similar pale young man with eyes quietly closed as the liquid trying to control his disease coursed through his veins. An older couple scrambling for change to buy a lottery ticket at the convenience store conjures the image of equally weathered faces resting quietly in the oversized chemotherapy unit chairs, waiting for treatment, waiting for hope, waiting for comfort. A young woman running to catch her bus brings tears at the reminder of another young woman who just last week ran out of time. She would occasionally catch others' eyes in transit fighting waves of nausea that accompanied certainty that they were all dying, but just didn't know it yet. Her sense that everyone would be ambushed by cancer became increasingly entrenched, unresponsive to collegial chatter. Over time, her colleagues' voices became irritants, their stress-releasing laughter an insult to all the dying and the ones that were to inevitably follow. The physicians were worse, with their generic chemotherapy orders sometimes written so sloppily it was clear even they didn't believe in the stuff. And the pharmacists were intolerable, constantly hovering over each milligram and minute as if it made any difference at all. Don't pay me any mind, dear. I'm not ungrateful, just mystified at the amount of effort and expense that is going into prolonging the life of an old woman who is ready to die. Don't you think when your time comes, you'll be ready to go after everything you've seen? Carrie gently disconnected Vera from the intravenous tubing and watched her slowly shuffle out of the chair toward the elevator. See you next month, Vera, she called out. Yes, maybe you will, but I hope not. Thank you, dear. Gently placing the plastic grocery bags on the wet pavement. The damp pockets of her jeans frustrated her bony fingers grasping for the keys buried deep within. She locked and unlocked the doors twice before the trunk finally unlatched, and she could see her pulse through the tension on the undersurface of her wrist as she heaved the heavy bags into the trunk. Once it slammed shut, she slid into the front seat and gripped the steering wheel before starting the car. Her knuckles nauseated her, and she noted that her hands looked quite similar to Vera's, her last patient of the afternoon. Yes, I guess in the end it's all the same, ready or not, she whispered to the empty car. Her head pushed back hard against the headrest, and she gripped the wheel until her knuckles blanched white.
I'm Dr. Lidia Schapira, Consultant Editor for Art of Oncology and your host for this program. My guest is Dr. Daniel Rayson, a medical oncologist in Nova Scotia, Canada, and a contributor to Art of Oncology. His latest essay, White Knuckling, appeared in the April 20th issue of JCO. Daniel, welcome to this program.
Thank you very much for having me on, Lydia.
It's our pleasure. Tell me, why do you write?
Well, I've always dabbled in writing, even before medical school, but certainly the area of medical oncology lends itself to anybody who might be interested in writing due to the intensity of our experiences, the struggles we have in taking care of these patients, and the daily situations we witness in relation to the people who we are entrusted to take care of. So for me, writing is a means of expression, a means of trying to understand complicated situations, to work through a traumatic experience with the patient or their family or a series of patients in a way that helps me get past the story.
In this story, you have the action set in an infusion room. We have two nurses, an oncology nurse, a young nurse, who has just disconnected her patient, who's an older, retired NICU nurse, who just finished her infusion of bisphosphonate for metastatic breast cancer. Is this story based on real characters?
It is, completely, with two individuals very firmly in mind, although the construction of the story and the conversation is fictional. I've projected what could be a discussion between these two particular personalities.
So tell us a little bit about Vera, the older nurse and patient.
So Vera was an amazing woman who basically ran a very busy neonatal intensive care unit without batting an eye and never losing her cool. And over the time I knew her, she just continued to struggle with this notion of all the effort that we were making trying to keep her well in relation to metastatic breast cancer. And she never really believed anything I've ever told her, but she followed orders like the good citizen she was, and always with a stiff upper lip, and always with a huge support of very similar-minded women who kept bringing her back and forth to appointments and to clinic visits, always a twinkle in her eye and never complaining.
And Carrie, the younger nurse, seems to pay special attention to her and is very caring. Tell us a little bit about the character of Carrie.
Well, Carrie was a young nurse who worked within the chemotherapy unit, who I knew for a few years and continued to struggle at different times with the intensity of the situations in front of her. She was an excellent, excellent nurse, but took individual stories very personally, very much to heart when patients didn't do well. And over about a year, I, somewhat from a distance, observed her struggles, and I knew that she was facing some difficult challenges in staying in her position.
She seems to be really struggling with the emotional pain, and I'll read a sentence from the story. Over the past few years, images would appear to her abruptly without obvious triggers. Do you think Carrie was actually suffering from some form of traumatic exposure or even some form of PTSD?
I do, and I think that's the major theme, of course, of the piece. And I think it reflects what I believe is something we all suffer to a certain extent, to a certain depth, at certain times in our career. Sometimes without knowing it, and sometimes clearly suffering because of it. It's a kind of repetitive traumatic stress because, of course, the patients keep coming, the situations keep having to be dealt with. It's really different from a true single event traumatic stress. It's more of a repetitive post-traumatic stress, and I do believe she was suffering from that.
Yes, the essay beautifully describes how she felt more and more isolated. You write, over time, her colleagues' voices became irritants, their stress-releasing laughter an insult to all the dying and the ones that were to inevitably follow. You convey how difficult this is for her. Do you have any other thoughts or reflections that you wish to share with our readers about the character of Carrie and these emotions that she experiences, this burden of pain she carries?
Well, I think what I tried to represent, as the story progressed, was a progressive decompensation in relation to the ongoing stress and trauma. Carrie represents what I think is a danger for many people in this area of medicine, that slowly but surely, with constant revisiting or constant exposure to stress, things do start becoming unraveled, and areas that we would think would be supportive as someone plunges deeper into post-traumatic stress or depression, I think become more problematic. And so I tried to represent my thoughts on that through Carrie's difficulties as the story moves forward.
And so let's go back to the title and, the way you begin and end the story with this image of white knuckling. And you say that basically we're all probably white knuckling to some extent in our difficult clinical moments. But tell us why Carrie had this hate relationship with her own knuckles.
Well, what I tried to represent there was what I knew to be an insecure personality, someone who was not secure in her own skin, if you know what I mean. And it was a fictional creation about this hatred of the white knuckles. The white knuckling was meant to represent all the uncertainty and all the fear and all the trauma, and how we all just seem to bear it, sometimes with clenched fists and white knuckles, and sometimes more easily. For Carrie, the character in this piece, it represented, I think, points of tension, points of anger, and points of insecurity all rolled into one. And I tried to use that as a visual to support the title and the theme of my thought that we're all at some point white knuckling through our work.
I thought it was a beautiful way of helping us think about this topic, and by detaching the scene a little bit from yourself as the writer, instead of inserting yourself in there, you sort of show us what's going on, and we can watch these two women or imagine we're seeing them and dialoguing with them. And, I found myself really feeling for both of them. Have you shared this piece with your coworkers, and has there been a reaction to it where you are?
Whatever is published through our group does get circulated, and of course everybody has subscriptions to JCO, so even if it's not circulated, people do know about it. The reaction has been definite and very positive in terms of reflecting on the issues that the piece tries to present. So some of these themes are very universal and have clearly resonated with some of my colleagues here. Again, the two characters in my head are known persons. The names are created by me, so nobody's identified. Only I know who they are.
What kind of responses have you had to this story, Daniel? Have people reached out to you or emailed you?
Yes, I've received a number of emails and a number of comments just in the hall. And most times it's a very quiet comment. You can tell, or I can tell, I guess, that the piece has impacted certain people. And it's usually associated with a thanks for having written something like this and putting it out there.
There's a beautiful gentleness to your writing and to your descriptions, and I know that other readers will probably find this also a lovely feature. But I think that one of the things that is so impressive about this article is that you tackle what is a really difficult problem for all of us, but you do it in such a lyrical way that we are sort of caught in it and continue to read it before we actually realize the seriousness of it. So beautifully done. Do you have any other thoughts now that the piece is published? Are there other things perhaps that you wish you would have written, or perhaps things that you would have taken out, knowing what you know now?
Well, thanks for those very kind comments, Lydia. No, I think, I was actually very, very pleased with the piece. I know it was a bit of a change for the Art of Oncology section, in that most times writers do place themselves front and center. Although it wasn't deliberate, I think a piece like this does perhaps expand the potential for contributors to think of some of these stories outside of themselves. So I was actually very pleased with it, and I'm very
That's terrific. Thank you very much for your contributions. I hope you go back to work and write some more. And thank all the listeners for joining me for this podcast of Art of Oncology. We'll see you soon.